My dad, others had passed on it or just couldn't figure it out. He was able to save my dad's life, and my family will always, always be grateful to him. But look, if you have newly diagnosed and recurrent cancers anywhere in the body, Gil Lederman's the guy to go to. He's a brain and prostate cancer as well as body cancer expert, also treating breast, lung, pancreas, liver, kidney cancers, and more. So, to hit the cancer, you call 212-CHOICES and set up an appointment with Dr. Gil Lederman, 212-CHOICES. Or do it for someone that you know won't do it for themselves. He'll send you an informative booklet, DVD in advance, and then you cop a squat with him at his offices at 38th and Broadway. Dr. Gil Lederman takes most insurances, Medicare, and Medicaid. Just call Dr. Gil Lederman for your cancer treatment choices at 212-CHOICES, 212-CHOICES, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WABC studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. Hey, Dr. Lederman, we're back.
Hey, we're back, and there was an article this past week about Dr. Oz. We've spoken about him before, endorsing products which have no value, including a lot of unproven remedies, vitamins, and other concoctions. So this past week he went to the Senate hearing, and there's an article in AP written by Alex Block saying Dr. Oz was put on the defensive Tuesday after appearing before a U.S. Senate subcommittee where he was taken to task for calling a weight loss product of questionable value, quote, a miracle in a bottle, unquote. He was admonished for melding medical advice, news, and entertainment in a way that harms consumers, quote, harms consumers. And he contritely said, I recognize that my enthusiastic language has made the problem worse at times. Senator Claire McCaskill said, quote, I don't get why you need to say this stuff when you know it's not true. When you have this amazing megaphone, why would you cheapen your show? Why? So he responded that he saw himself as a cheerleader for the audience and said he doesn't actually ever endorse products. Well, that's a big surprise for the viewers. He later said that he took part in the hearing because he's accountable for his role in the proliferation of these scams, and he recognizes that enthusiastic language has made the problem worse at times. Even before the hearing, the article goes on to say Oz received plenty of criticism for those who questioned the value of highlighting weight loss treatment and other cures for diseases that are not supported by scientific data. An article published in the Daily Beast said, as a physician, his credentials are impressive. He's a vice chairman of surgery at a top medical school. Quote, but somewhere along the way, he decided that his fame was more important than his credibility. McClaskill ended saying, we didn't call this hearing to beat up on you. We called this hearing to talk about a real crisis in consumer protection. And you can be part of the problem or you can be part of the police. Oz said he wants to be part of the solution. So let's see if he reforms himself. He's got a lot of reforming to do because he's spread a lot of wrong information to people. And for a doctor, Harvard graduate, he should know better. There's another article about needle biopsies being underused for women with breast cancer. We just had a patient Thursday who walked in, which we'll talk about in a few minutes. I alluded to her before. Wonderful woman, 60 years old, who has a mass in the breast. She saw a surgeon who wants to do cutting out of the breast and radiation to both breasts, she said, and chemotherapy and hormones. And she got scared and ran away and left the cancer, which is probably a cancer, don't know for sure, left this growing in her breast for another 6 months because she was so scared by the surgeon. And now there's an article that was just published by Catherine Doyle in Reuters that says, quote, most women should undergo needle biopsy for breast cancer diagnosis, but some surgeons opt for a more invasive procedure instead, according to a new study. The difference may be a matter of surgeon experience, so many women could benefit if surgeons were trained for needle biopsy. A senior doctor in the study, Dr. Benjamin Smith from Texas, said a needle biopsy is the standard of care. Having a 3 or 4 centimeter surgical incision, like a 2-inch incision in the skin of your breast, is going to hurt more and take longer to heal than just putting in a needle. Now, this woman I sent for a needle on Thursday, I called her up Friday morning, asked her how she's feeling. She's feeling fine. She's feeling perfect. She came to me Thursday afternoon about 2 o'clock. I examined her, got a history. She had mammogram. She had ultrasound. Called up a great radiologist. Got her arranged to be seen immediately. He put a little needle into the tumor, sucked out the cells. It's going to a pathology lab. Showed the answer early next week. No downtime, no side effects, no incision, no cutting. That's what we want. We want to do the minimum possible to get the most information. We want to spend the least of your money to be most cost effective to get the answer directly without harming you. So that's what I believe, and the study confirms the same, that the best option is to have a needle biopsy. Often interventional radiologists do it. They're great at it. They don't have any conflict of wanting to do a more expensive, more invasive procedure. And speaking about expense, listen to this patient. 55-year-old woman came in with facial pain. She had radiosurgery elsewhere. I didn't quite understand why she's seeing me if she had radiosurgery elsewhere. Well, she had the old-style radiosurgery with the screws on in the head that we abandoned in 1993. We abandoned 21 years ago. She came in telling me this story, and it's all true. She had documents of everything. She's 55. She had facial pain. She was found to have a meningioma. It was around the trigeminal nerve, which is a nerve that goes to the face and is responsible for sensation. She went to this big hospital and saw this big surgeon who told her she had to have gamma knife treatment. She wasn't given any options. She said he came in with a clock, and he measured the minutes he was with her. She said it was just a few minutes. They gave her one treatment with gamma knife. She said it was very painful because the screws go through the scalp into the bone, into the skull. She had one treatment. She saw the doctor one more time for a few minutes, twice. Her insurance paid $30,000. She's getting bills for $70,000. She doesn't have the wherewithal to pay. She needs to see a doctor, and this doctor won't see her because she's not paying her $70,000 copay. So when we talk about prices and facilities in hospitals, we know, number one, we are the low-cost facility. Private medical centers cost less than hospitals. When you see big buildings and big lobbies and big monuments, someone pays. And guess who that is? Yeah, that's right, it's you. So if you want to pay for a monument, you can go to this place. This guy's still waiting for his $70,000. He's not returning the call. The patient has symptoms. She was never told she could have fractionated radiosurgery or other methods of treatment. Fractionated radiosurgery means, number one, there's no pins in the head. It's not painful. It's not invasive. We take advantage of radiobiological principles to protect the healthy surrounding tissues. We've been at this for more than 20 years, treating thousands of patients. We have data. We offer all the options because we're not afraid of talking about gamma knife or any other methods of treatment because we've done that. We've been there. We stopped it 20 years ago because it doesn't offer the advantages of fractionated radiosurgery, which is non-invasive and helps protect the normal, healthy tissue and costs a heck of a lot less. So why is she with us? You can guess why she's with us, and we take care of her, and we'll answer her calls, and we'll spend time with her, and we're not going to bring our clock in to count every second that we're with her as if our time is more valuable than the patient's time. Everyone's time is valuable. Her time, the patient's time, she deserves a call back. She had a relationship with that doctor. If she doesn't have $70,000, she should get her calls called back. Wow. Wow, wow, wow. Why do people come to us? It's easy to see. Listen to Grandpa Joe Lederman's grandson. We sit down, we close the door, and we spend time with the patient. That's the key. Listen to the patient. Examine the patient. Understand the patient, and you'll be a lot smarter. Hey, in the good news department, we had a gentleman come in I treated in the year 2000, almost 15 years ago. His PSA was 15 then, prostate cancer. He's now a 70-year-old Italian stallion, sexually active. 15 years after our treatment in the stereotactic frame and brachytherapy for a pretty high-risk prostate cancer, PSA 15. His PSA is now down to 0.01. He's doing well. He's sexually active, fully intact, cancer-free, no further treatment after all those years. So, good news department, yes. He has entered the good news department. Who's signing up for the new health care Obama plan? Well, there's articles this week, and one was in Wall Street Journal just this week, an article by Anna Wild Matthews and Christopher Weaver, saying that people enrolled in the new health law have higher rates of health conditions, serious health conditions than other customers, according to early analysis. New health law marketplace enrollees, well, 27% of them have significant health issues such as diabetes, psychiatric conditions, asthma, heart problems, or cancer. 27% of them have serious medical conditions compared to the 16% for last year's individual consumer market over the same time frame. So it's nearly twice as many people have serious medical conditions. It's also twice the rate of people who held on to their existing health policies. That rate was 12%. So what's going to happen? Well, the insurance companies, when they see that there's more sick people, they'll collect their money. Don't worry about them. They're going to raise the premium on us all, and then they get kickbacks from the government because they're supposed to spend more money, and they get guaranteed profit. So it's great business to be in the insurance business when you're guaranteed by the government and you can just increase the premiums. Some companies are offering low rates, hoping to lure people in, and then they'll raise the rates. Others are waiting for the government to kick back and pay them. Either way, it seems like they win. Do we win? Not so sure. We'll see. We're going to hear from some new voices about radiosurgery. If you wish to call us, please do so. We're live at the WABC studios. Our number is 1-800-848-9222, 1-800-848-9222. Here we go.
You know, cancer, it's not prejudice. It strikes everyone. We've seen the racists with the big C. We've seen humanitarians struck down with the big C. But there are remedies, even if you've already had different measures of treatment, like prior chemo, surgery, or radiation that didn't work. Now, I'm telling you, there's a guy out there who is clearly the best at this. First tryout or second tryout. That's Dr. Gil Lederman. My personal experience in 1991 is he came up with a remedy for my dad. Others had passed on it or just couldn't figure it out. He was able to save my dad's life, and my family will always be grateful to him. But look, if you have newly diagnosed and recurrent cancers anywhere in the body, Gil Lederman's the guy to go to. He's a brain and prostate cancer as well as body cancer expert, also treating breast, lung, pancreas, liver, kidney cancers, and more. So, to hit the cancer, you call 212-CHOICES and set up an appointment with Dr. Gil Lederman, 212-CHOICES. Or do it for someone that you know won't do it for themselves. He'll send you an informative booklet, DVD in advance, and then you cop a squat with him at his offices at 38th and Broadway. Dr. Gil Lederman takes most insurances, Medicare, and Medicaid. Just call Dr. Gil Lederman for your cancer treatment choices at 212-CHOICES, 212-CHOICES, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WABC studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street.